All right, so basically we'll just informally discuss why is it important to monitor for individuals to monitor their own blood glucose rather than waiting until they get to a healthcare facility to have the professionals check to see what their blood glucose is, right? And as I go along, if you have any questions, feel free to just ask the question and then we can discuss what it is. So, home blood glucose test. And what is home blood glucose testing? It's a test that measures the amount of sugar in your blood at the time of testing, right? And people with diabetes usually need to check their blood sugar at least once per day. So at least once per day, depending on the reading or the type of diabetes, people, it can be required for the blood sugar to be tested up to 4 times per day. Right, and that the finger stick, it basically measures blood sugar at that point. There is another test which is done, the hemoglobin A1C, and that measures the average blood glucose in the blood over a 3-month period. So that is done either every 3 months or every 6 months based on your control. Okay. All right, so why is it done? Why is it important for us to be sticking our fingers every day or up to 4 times per day? And testing the blood glucose levels provides information about the blood sugar levels and to prevent emergency situations, right? So you want to know what affects your blood sugar. Is it too low? Is it too high? Whether it's too high or too low, you can end up with an emergency situation. So you want to know what it is at any given point in time, especially if you're, for example, going out to do some form of exercise, whether it's walking or jogging, cycling, whatever you do for exercise. It's important that you know what it is at that point in time. Reason being is that the exercise will affect the blood glucose level, and most time it tends to drop low. So you want to know where it is before you go and exercise.
Test it before I go exercise.
Yes. So if it's low, you want to have something to eat before you go. Yeah, although you should always have something on your hard candy, or you can't run with oranges, but preferably hard candy. If it's high, you don't have to take anything. You're going to exercise, but when you come back, you want to take it because it depends on your medication regime. You probably have to take medication after you're back. So it depends on how high it is then. Yeah. So exercise, diet, stress, and being ill also affect the blood glucose. And as we discussed, if it's exercise, you want to test it before you go out to do any form of exercise. And you have stress and illness, which usually causes it to go high. So there are times when you get ill or you're in stressful situations and the blood glucose will be elevated. At that point in time, usually the blood, whether it's insulin or oral medication that you're taking for the diabetes, usually the doctor will not change the regime. Instead, we want to treat the illness before we do anything to the medication. Because more than likely, it's the illness, which is a form of stress, that is causing the blood sugar to be elevated. And also, there are some individuals who are on insulin, and the insulin is given, the amount of insulin that is given is based on the level of blood sugar at the point in time. Yeah? So what affects the test? There are a number of things that can affect the reading of the test that you do at home. And the list that I have here, it's just some of them, or the most common ones. For example, alcohol in the drop of blood. Most people clean the finger with alcohol swab before they do the finger stick. At all times, you want to ensure that the finger, after you've cleaned it with the alcohol swab, it's dried, completely dried before you actually stick it. Because if there is alcohol remaining on your finger and any amount get into the blood sample after you've pricked it, then it's going to affect the reading. It's going to make it lower than it normally, than it is actually. Yeah. Now, water or soap on your finger. You can just wash your hand with soap and water before you do the finger stick, but you should always ensure that the water and the soap is totally cleansed from your finger before sticking it. Squeezing the fingertip, that also affects the blood glucose reading. And why is because when the finger is squeezed, you damage the red blood cells, or you get serum, the other part of the blood that's the other component of the blood. So you'll get some serum in the sample, and that also affects the blood glucose reading. So what you want to do is to make sure that you have, when you prick your finger, the sample flows freely. So you don't have to squeeze it to get out of it. You squeeze your finger before, that's it, and it should be like that, and then you prick it, and the blood will just flow. But there are some people who prick the finger, then squeeze and squeeze and squeeze to get a sample out. That you shouldn't do. Yeah? Now, humidity or a wet test strip will affect the reading that you get. So the test strips are supposed to be kept in a dry place. It should not be stored in the bathroom. Yeah?
It happened to me once. I put my strips in, and I find I had water in my hand. And
It was wet.
It showed that there's hair on it. And I was wondering what happened. And I changed and I did the same thing again. It's still not dry in my hand. And it happened again. I said, all right, but I will rewash dry. I really didn't know that it was because of the
water on it, yeah, yes. So once your hand is thoroughly dry, then you'll get a reading. Okay, so the blood glucose testing, there are normal readings, and we have measurements that are before meals and those that are after meals. Okay, and before meals meaning the first test in the morning before you've had anything to eat. Right, and 70 to 120 milligrams or 3.9 to 6.7 millimoles is what that reading should be.
And they got a 80 log last night.
Okay.
So their targets
Are on the log. Okay, okay. Yes. And that you didn't get one last night?
Yeah, I got
Okay. All right. And then after meals, and when we say after meals, we mean 2 to 3 hours after you've eaten a meal, then the reading should be in this range, 80 to 140 milligrams. Okay?
And you're telling me that those are normal. Must be that supposed that 100 and further up.
80 to 140 is where you want it to be. So anything 160, 180, 200, that's abnormal. That's not controlled. But once you're controlled, 2 to 3 hours after you've eaten, the blood glucose level should fall back within this range, anywhere between 80 to 140. Yeah. Okay. The other slide is something else. So that's primarily what we have on blood glucose, self-blood glucose testing. Well, so
There's a question about strips. Where would be the cheapest, where would be the best place to get the best rate on strips if you don't have insurance to get it from pharmacy here on prescription?
if I have no idea. I know that on average, yeah, it's $1 per strip, but I'm not sure that there is anybody else who sells it for less than $1 per strip. So yeah, I'm not sure. Okay, any questions? Any further questions on self-blood glucose monitoring?
To get low figures, divide by
18, yes, yeah. If you're accustomed to using the smaller numbers, when some machines will give it to you, the reading to you in milligrams. So you'll get 140, 180, that sort of reading. if you're accustomed to 3, 4, 5, 6, that reading, which is millimoles, then you just divide by 18. And the reverse, if it's the small number the machine is giving and you are accustomed to the bigger one, you multiply by 18. Yeah? Okay. Okay. All right. So the other aspect that we look at is the foot care. All right. So foot care is all, and you can understand foot care, it's care of the feet. How do you care for your feet? And that you can understand why it is your responsibility. Your feet goes with you everywhere you go. You have your feet. You're in control of your feet. Therefore, you're the ones who have to take care of your feet. Yes, when something is wrong, you'll come to the physician and you'll get advice on what to do or treatment if it necessitates treatment. But prevention, you have to actually take that active role in taking care of your feet to prevent any of the possible disease conditions that are associated with uncontrolled diabetes. Okay, so we'll just look at some of the common problems of the feet for diabetics. Now, so why should we worry about your feet? Why should you even care about your feet? Reason being is that the loss of feeling in your feet makes it hard for you to tell if you have a blister or a sore. Most individuals with uncontrolled diabetes that has been left out of the range that I showed before, that has been higher than those numbers for a long period of time, it damages the blood vessels, it damages the nerves, and therefore you lose feeling in the feet. So if you step on anything, any injury to the feet, whether it's a matter of fact, if you step on a piece of cotton, it's very difficult for you to feel it. If you step on stones, you can get a blister. If you have calluses, you don't know it's there. So you have to then examine your feet every day. Now, if these sores are not taken care of, they get worse and they turn into ulcers. And if these ulcers become infected, you may have to go to the hospital or have a foot amputated, right? Now, these are the things that amputation is what we're trying to prevent by promoting foot care. And again, the amputation, if there is no feeling, it's easy for ulcers to be there and we don't know. So you have to always be looking at your feet, and anything there that is abnormal or you consider strange and abnormal, you need to go to your healthcare provider and get some advice on what is happening there. Now, there are some common foot problems, very common ones. The list here, it's not all the problems, but these are some common ones that I mentioned. Corns and calluses, there are thick layers of skin caused by too much rubbing or pressure on the same spot. And we basically know what corns or calluses are. The thing with these calluses is that sometimes the top of them seems so thick, but underneath there is an ulcer. And again, because there is loss of feeling, you can't tell. There is no pain, it's just there. And underneath that ulcer, that callus, it can become infected. Yeah? Now we also have hammertoes, and these are caused when the muscle gets weak. The weakness can be from a diabetic nerve damage, as I said before, which causes the toes to curl under the feet. And where the toes curl, you can get, right there, you can get sores under the bottom of the feet or on top of those toes. Yes? So, again, it's one of the main reasons, primary reason why you want to look at your feet, examine your feet every day, and most importantly, control your diabetes. Because if the diabetes is controlled, then the nerve will be preserved and you won't get that damage to cause any of these conditions that we're talking about. Bunions. And these forms when the big toes slants towards the small toes and the space between the bones near the base of your big toe grows big. Pointy shoes may cause bunion. So again, for diabetics or for anybody, not necessarily diabetics, we always promote proper shoes. And now shoes, now we have very stylish shoes, but a lot of them does not fit the shape of our feet. So when the feet are in the shoes, they tend to take the form of the shoe. So you get a point. The proper shoe should be square, and your feet should fit properly in the shoe, and you should be able to move your toes. Okay? And then you can prevent these bunions. Now, ingrown toenails. Again, this happens when the edge of the nails grow into the skin, and you can see from the side of this toe, this one, or these. And it can happen when you cut into the corners of your toenails when you trim them. And the sharp edges should be made smooth with an emery board. So whenever time you cut your toenails, and for diabetics, it's important that if you're going to cut your toenails by yourself, you should be able to see properly. There are some diabetics, again, because the diabetes have been left uncontrolled for a period, it tends to damage the nerves and the blood vessels of the eye, and the vision gets impaired, or there's a decrease in the vision, making it difficult for them to see how to cut their toenails. So what happens is that they nip either the skin or they cut the toenail not following the natural curvature of the toe and end up with sharp edges and ingrown toenails. So if there is any problem at all with vision, you want to ask somebody else to cut your toenails for you rather than cutting them yourself. Now, blisters, and you may ask, how can somebody have such blisters and they're not in severe pain? How would they not know that they have this blister happening? Because blisters are very painful. If you've worn a new shoes or a bad fitting shoes, as soon as the blisters start, as long as you have feeling, you're going to know. But these blisters, there are some diabetics who have nerve damage. They cannot feel, so the blisters can get as bad as this. And if someone doesn't point it out or the person does not examine the feet, they don't know that they have these blisters on their feet. And the blisters can form if shoes always rub the same spot. Wearing shoes that do not fit or wearing shoes without socks can cause blisters. And these same blisters can become infected. Yes? Okay. And then we have athlete's foot. Now, athlete's foot, it's a fungus that causes redness and cracking of the skin. The cracks between the toes allows the germs to get under the skin. If the blood sugar is too high, it feeds the germs and makes the infection worse. And the infection then spread to the nails, making them thick, yellow, and hard to cut, which is right here. So athlete's foot, and then it spreads to the toe. So again, if the blood glucose is controlled, this problem we can prevent. Okay? However, if we're having a challenge in controlling it and we develop athlete's foot because of the high blood sugar content, then it also can become infected. So if there is any examining the feet, looking at the feet, if there is any blisters, any cuts, you always want to make sure that you find your healthcare provider who will be able to give you something to assist in the healing process and prevention and prevent any infection that might occur. Okay. So, is there anything that we can do to keep the feet healthy and prevent any of the previous conditions that we've seen before? And yes, there are some things that we can do to have these pretty looking feet rather than the ones that we saw before. So, wash your feet in warm water every day. And I say warm water, and again, it's very challenging for some diabetics to determine the temperature of the water because of nerve damage. So they might burn themselves if they're going to use, for example, their feet. That's already has decreased feeling. If they're going to use their feet to test the water, that is dangerous. So it's recommended that you use warm water, and you should always use your elbow to test the temperature of the water.
Are you telling me that as long as I'm a diabetic, I have to use warm water to wash it? Or it doesn't matter, but occasionally?
Yeah, yeah. You don't always have to use it, but you can use the warm water to take care of them. Yeah? It's easier to get your dead skin and all of that off of it. And you also want to look at your feet every day to check for cuts, sores, blisters, calluses, and other problems. And again, this daily examination, it is important, and you want to get into the habit of doing it every day. Just looking at your feet to make sure that there are no cuts, no blisters, or any sores. If you sort of time it with, for example, something that we do every day, we brush our teeth every day. So you can associate it with toothbrushing. Now I'm going to brush my teeth. So I want to examine your feet and look to see if there is anything unusual with the feet. And if there is, then you want to take the necessary action to prevent it from getting any worse. Now, if your skin is dry, rub lotion on your feet after you have washed and dried them. Now, you can rub lotion on your feet, but never rub the lotion between your toes because it keeps it very moist, and that can break down the skin between your toes. So always, if the lotion gets between your toes, make sure that you use your towel and dry between your toes properly. Okay. File corns and calluses gentle with a pumice stone or an emery board. And this should be done after a bath or shower. Reason being that after bath or shower, the calluses or the corns, they're soft. So that dead skin is easier to come off rather than doing it when it's dry. And then cut your toenails once per week or when needed. And again, what I said before, if there is any issue with sight, please ask someone to assist you in cutting your toenails. Never attempt to try and cut them yourself, because you might just nip yourself. And always wear shoes to protect your feet from injuries. So you should never be, diabetics should never be barefooted at any point. You should always have shoes on your feet to protect them from any injury. And more so, if there is loss of feeling, you want to always, always, always wear your shoes. Okay, always wear socks or stockings to prevent blisters. And wear shoes that fit well. Before putting on your shoes, feel the insides to make sure they have no sharp edges or objects that might injure your feet. Okay, so you want to make sure you feel inside of your shoe or turn it upside down and empty. And you know, sometimes you have little stones or something that might be in your shoe. If it's on and it's still there, it can create pressure and then give you a blister or a corn on your feet. So always examine your shoes too. Okay, and you should get your feet examined by your doctor or nurse educator at least once per year. And this examination, while at home, you are looking for obvious injuries, bruises, blisters. When you go to the physician, then the physician do more. They look for the pulse to determine blood supply, and then they check for loss of feeling using a tiny what we call a monofilament. It's like the bristle of a brush. So yeah, so they use that to check if you have any loss of feeling. So that is what that examination is for. Okay, any questions?
You talk about the numbness.
Mm-hmm.
Numbness in the
Yeah.
especially it's like sometimes when I leave work and I go home relaxing, I tend to numb. Like numbness there. Sometimes I have to exercise in my toes.
Mm-hmm. Mm-hmm.
That happens like maybe for 10, 15 minutes sometimes. As long as I'm sitting down, but when I'm walking, it's all right. If I go walking in the morning, I come home, maybe take my shoes off. And most of the time I take my shoes off, my sneakers off, I keep my socks on.
Mm-hmm.
But sometimes it gets so numb that sometimes I have to take a while.
Have you ever had a foot examination done?
Actually, last year I think I went to the doctor. He said something about, I don't remember what the big word that he used, but he said to exercise my bottom, rolling the towel, or if I have a exercise on dumbbell, I can use it to roll my, because he said that you know that my bottom is getting thin, but then a couple months ago I went to the doctor, she said that borderline to diabetes.
To diabetes.
Then sometimes I'm watching the TV and that's one of the symptoms. But he said numbness, even sometimes from my leg, my leg behind my
Mm-hmm.
goes
Mm-hmm.
through that and get like a sharp pain, intense pain. Maybe for 5 or so minutes.
Yeah.
And have to both of them, not only one, both.
But what have you, I would have to look at your readings to see what, because you've been diagnosed as borderline diabetic, right? And usually when you're told that you're borderline diabetic, you want to take all the steps, all the measures, all the lifestyle changes, include your dietary intake, your exercise. So yes, so you have to do. If you don't, what is going to happen? You're just going to go right over into having diabetes rather than borderline diabetes or pre-diabetes as it is called. So you have to, once you're pre-diabetic, if you take all the necessary changes, you can delay the onset of diabetes or prevent the onset of diabetes, but you must make all those changes that you have to make. And it has been said that frequently before diagnosis, you have damage to the smaller blood vessels and nerves before you're actually diagnosed with diabetes. So you want to start as soon as possible. The fact is, you know that you're pre, so you want to start as soon as possible with all the changes that you need to make to delay or prevent the onset of diabetes.